This video is for anyone that may be considering a career in the medical field, but you don't want to really be a clinician. You don't want to be a doctor. You don't want to be a nurse, but you still want to make a difference and an impact in the medical industry. So you choose to dive into the business side of medicine. Hello, everyone. My name is Kat, and I am the owner of Superior Medical Consulting, where we provide superior medical billing solutions for your private practice. I am a certified professional coder, certified professional medical auditor, and a medical biller. And this is Level Up Medical Coding. But in today's video, we are going to be talking about the qualifications that I feel like you would need in order to pursue a career as a medical biller or a medical coder. First off, let's talk about the role of a medical biller and medical coder. Medical billers and medical coders are essential to the healthcare industry. They ensure that accurate and efficient billing processes are being done. Medical coding involves the translation of medical diagnosis, medical treatments, and medical procedures into standardized codes that insurance companies record keeping can identify with. While medical billing, on the other hand, focus on claim submission, claim processes, and follow-ups for said encounters, and to make sure that proper reimbursement is given. So the educational requirements for this type of profession. So most likely you will need at least a high school diploma or GED. It's the foundation. You can't get around that. Most jobs list that in their qualifications. You have to have a high school diploma or GED. Great thing about either one of these professions is that you can get a job with just a high school diploma or a GED. You don't have to have any college at all if you don't want to. That means you will go the route of just gaining a certificate. So a certificate is basically either, going through a training, like a trade school type of situation, whereas you just get the training for that skill, which in this case would be medical coding or medical billing, and you complete everything with that, and you're able to sit down and sit for your certification, for your credential. You're able to sit for that. So like I said, they don't require any college at all. You just find a program that offers medical billing or coding. You study that program, pass whatever, criteria they have you pass. Is usually assessment tests. And then you are able to be eligible to take your CPC exam. And I'm talking in terms of AAPC. You also have associate's degrees. It's not always mandatory, but there are health information technologies or any related fields that offer medical coding and medical billing, whereas you can get your associate's degree in health information technology and also be eligible to sit for your coding exam or your billing exam. It's more comprehensive, so you get more education. This has the potential to give you a higher pay entry level position. It definitely is a great bargaining tool when you are negotiating your salary, because you do have college level education as opposed to a high school diploma or a GED. So you will potentially get paid higher. In our profession, we do have a pay scale, as with many career professions. So you have the potential for higher paying positions, and it sets you up to be able to have career advancement, maybe a little bit quicker than it would be if you don't have an associate's degree, but it's definitely not necessary. So those are the two like entry level types of situations that you will have. Someone that doesn't have a degree and decides that they want to just go ahead and take a trade and get the certificate. Someone that does have a degree but also still wants to get certified. You also have a bachelor's degree in healthcare information technology with a concentration in whatever you need to have a concentration in. And then, if you want to do higher level, things in the coding department, like director, management, whatever, you could get, like a master's or whatever, but we keeping it basic. All right. So beyond formal education, you will be expected to have the following skills. Great attention to detail. You need to be able to accurately look at a medical record and a claim and make sure that every piece of information that is needed to make that claim a clean submission is on that claim. So attention to detail is a must. If any other profession besides like being a clinician, that I know of, that I'm familiar with in the medical world, that you need attention to detail, it is definitely coding and billing. You need to be able to be analytical in your thinking. So you will be analyzing things. You will be making sure that the appropriate codes are assigned, that the appropriate procedures. Okay, you also have to be able to think analytically. You will need to analyze medical records to determine the appropriateness of codes and procedures for billing, that encounter. You also need superior communication skills. Effective communications is vital for healthcare workers, healthcare providers. You will be in communication with providers, insurance companies, and patients, depending on your role as a medical coder or a medical biller. So you would need to be resolving, any discrepancies, or you will need to clarify information. Coders send queries to doctors quite a bit. Coders also, help billers out into getting denials resolved. The billers contact, coders quite often to help, with denials. They also contact insurance companies, and they also talk to patients quite a bit. So, communication is vital. You definitely need to knowledge of the coding systems, whether you're a biller or a coder. You need to understand the ICD-10 codes and the CPT codes. You also need to understand your HCPCS codes, your modifiers, and everything. You will need to be certified, especially if you are a professional code. If you are wanting to be a professional coder, you have to get your certification in order to do that. If you want to be highly sought out medical biller, it's highly suggested that you get your certification for medical billing. AAPC offers, the most, I guess, foundational credential would be your CPC. That's your certified professional coder, that validates that you have coding knowledge. In addition to that, AHIMA also offers what they call a CCS. That's their most foundational credential, and that stands for Certified Coding Specialist. And they focus on inpatient and outpatient coding. So if you are just like wanting to do outpatient coding, and getting certified with your CPC would be your best bet. If you want to do outpatient and inpatient coding, a CCS would be your best bet. One over the other really doesn't matter. I'm a CPC and I bill for outpatient and inpatient services. But if you don't want to have to wing it, maybe your CCS would be your best bet. If you want to do both, I don't know the curriculum of the CCS, but I know AHIMA is, a gold standard or whatever. Also, you do have the American Medical Billing Association. They have certifications that you can get for billers. They have what they call a CMRS. It stands for Certified Medical Reimbursement Specialist. And AAPC also have what they call a CPB, which is the Certified Professional Biller credentials. So those are some credentials that you can get. You also will need to gain practical, knowledge and experience. Um, this career is very, very in demand, but it's sort of hard to break into. So hands-on experience is very valuable. If you are able to get internships or externships, that will work. If you're able to get some kind of on-the-job training, that will be so helpful. A lot of programs, when you get your education, they offer, like internships, or externships. And if they do, I highly suggest you take advantage of those, because that will help give you a leg up into getting, a job in this field when you get done with your classes or whatnot. So that's that. And if you happen to need information on how to secure your first job as a medical coder or a medical biller, I'll insert a video in this up here in the cards that will give you my tips on how to get your first job as a medical coder or a medical biller. Um, so let's talk about job opportunities and advancement. So after completing your education, more than likely you will be going after your entry level roles. That would be, like a coder one, a medical biller, like a coding specialist, or like a billing coordinator or something like that. In facilities that I work at, they usually have either data entry coders or coder ones. That is like when you first out of school, they basically assign you tasks to kind of get you used to understanding the code sets and how to use them, how to use your book, how to use your software, things of that nature. Typically is data entry with some, making sure that you do minor corrections to it. And I'm talking from a coding standpoint, that's usually an entry level role into a coder. Then you will have your coder twos, where you will and this is not universal, but this is kind of some tiers in coding. You will have your coder twos, which is like E&M coding and minor procedure codes. So like you will have your specialty clinics, whatever codes they use, if they do like minor procedures and like I said, E&M coding. Then you will have your senior level coders or your coder threes. Some coder twos do surgeries. I'm a coder two and I do surgeries, but it just depends on the facility that you work at. But the next leg up above that in non-management roles are coding surgeries, complex surgeries, and things of that nature. So you do have your tiers with that, and it goes from entry level to like, I guess not so entry level. um, let's talk about career advancement. So without having to have like a college degree or anything, you have to put in the time equivalent with that. So with time and dedication, and with, I guess, more training, you can advance into other roles like auditing, or like coding manager, or like supervising, leads. Getting additional certifications such as your CPMA, which is your Certified Professional Medical Auditing certification, will help you to advance in your career. It'll help you become maybe you want to be an educator, maybe you just want to be in compliance. So it'll help you with things of that nature. So there is opportunity for growth in this career, definitely. Um, so let's talk about getting into the job market, because the hardest thing about being a medical biller or a coder, more so medical coding, but it's, to get into the job, to get a job. So I'm going to give you a few quick things that I will want you to pay attention to when you are actively looking for a job. And this will help you along to try to secure your first job if you haven't done so already. I do have, like I said, a video or two that may talk about getting into the career of this profession. And again, I'm going to leave it in the cards above. But first off, I would like to say networking. If you have your credential and you are a part of, your local chapter that you received your credential with, whether it's AAPC or a HEMA, you should have like a built-in networking conglomerate on your side. AAPC is what I'm going to be speaking about, because that's where I have my credential through, and it's what I'm familiar with. But AAPC, our local chapter, has monthly meetings, whether it's online or in person. They also have like networking events that you can attend. And then in those events, it allows you not only to gain your CEUs, but it allows you to connect with professionals in your industry where you can just talk code and, like get your name out there that you are, looking for a job. It exposes you to different, clinics and hospitals and providers and all of that, because sometimes professional clinicians come and speak, and they let you know that they're hiring. And those are events, this great industry events. They also have like what is it called, oh my god, conventions. They also have like conventions a couple of times a year in different states where you get all the professionals, a lot of professionals together, and in forums and that and such, so you can network. So definitely take advantage of your networking opportunities, especially if you are in the job market. Also, you have online forums and social media platforms like LinkedIn, like TikTok, like whatever. But definitely LinkedIn will be very beneficial for networking. um, Use your job websites and career pages, and local temp services to help you find job openings. I know in my area, in addition to like Indeed, we have like Career Link. I do know like some places like all the little job websites, you know what I'm talking about, like Monster Jobs, I think that's what it's called. Snag a Job, just different stuff like that. I don't even know if Snag a Job is catered to medical professionals, but whatever. Look at your online job search engines and websites, the local hospitals and healthcare facilities that you can think of in your area. Go to their websites and find their careers page, and look through that way. Talk to any other billers or coders that you may know. They may be able to let you know if their healthcare facility is hiring. Go to staffing agencies, a temp service, and they will be able to help you also, find something. I do know a clinic that I worked at utilized staffing agencies quite a bit because they had a lot of PRN work, and some of those PRN contracts led to long-term employment because they was already familiar. They had to train that person to come in anyway, and they realized that they needed that, that position to be ongoing, and they end up hiring the person. So that's that. Your cover letter or your resume. I think I also have a video on my channel talking about your cover letter and your resume. But you need to craft your resume that highlights your skills, your relevant experience, your education. I suggest that any job that that you are interested in, to go to that particular website and the qualifications tab, and anything that's relevant to you that you have experience with, that you have done, worded in similar wording to what they have on their website that resonates with you and what you really did, so that when they do scan that your resume, they see stuff that stick out to them that matches exactly for what they're asking for. Don't lie, but make sure that you put yourself in the best light on your resume. Make sure your cover letter is good. A lot of people say cover letters are played out, but I don't know. To me, if they ask for it, I make sure I include it. And I also follow up with, a phone call asking them, can they review my resume and tell me what they think. And so once you do all that stuff, and hopefully, fingers crossed, you get an interview. In the interview process, you should discuss your qualifications, your skills, anything that is relevant for you to, big up yourself, that you have, learned through previous experience or through your coursework. Make sure you highlight, put yourself in a great light, put a positive spin on everything, but be real, because we're all human, and recruiters and HR and even directors of departments are looking for that real. They're not looking for the perfect answer, but they're looking for the real answer that is professional. So those are my tips for navigating the job market and for advancement in that career. So we come to the end. So I've given you like all of my thoughts on qualifications that you would need to become a medical biller or coder. I gave you a little pathway to pursue your career in this field. Um, Remember that medical billing and coding, like, it plays such a huge role in the healthcare industry. We are part of the quality, patient care. We have to ensure that accurate billing and record keeping is like the forefront of what we do. And so you have to make sure that you maintain an ethical delivery in this profession. And also, just make sure that you are very well organized and detailed and your quality is superior. So if you find this video helpful, I will ask that you please give it a thumbs up. Share this with anyone that you know that's interested in medical billing and coding and that will find this helpful and that's looking for sort of like a career path to navigate through. Don't forget to subscribe to the channel. And y'all, I'm not yet consistent yet, but I'm getting there. I'm getting there. I'm getting there. But until I get some consistency going, the best way to know when I post a video is to make sure that your bell notification is turned on. It'll let you know when I decide to go ahead and release a video. I want to thank you so much for watching Level Up Medical Coding, and I will see you in the next video. Take care.